Welcome again, folks. Today we're going to discuss Plan N, as in Nancy, Plan N. This is a continuation of our series concerning Medigap plans, Medigap policies, Medicare supplement plans, Medicare supplement policies. Remember, all the same terms, just used interchangeably, so don't get confused when you're out in public and you hear these being discussed. Plan N is one of the many plans available to you. Remember, these Medicare supplements, Medigap policies, are designed to pick up the costs that are left over by original Medicare Parts A and Parts B. None of this has anything to do with Medicare Advantage. That's a completely separate animal that lives off in the wilderness. Today we're off in the garage and we're discussing Parts A, Parts B, what they've left behind, and how this Medicare supplement plan or Medigap policy plan N can help you cover some of those left behind costs. So that being said, let's look at this. First thing, let's go ahead and go over some terms and some stuff that we like to preface before we begin. Number one, skilled nursing facility care is not the same thing as long-term care. You will want to explore the difference in that, and if you need a long-term care insurance option, then that's something you need to shop separately. Understand what Medicare means when they say that, okay? Number two, Part B excess charges are not always allowed in every state. Thus, if you live in a state where Part B excess charges are not allowed, then you really have nothing to worry about if your plan does not cover those. If Part B excess charges are allowed, all you have to do is speak with your provider before having services rendered. Say, provider, do you accept Medicare assignment rate? If they do, then you don't have an issue there. Okay, so there's a way around Part B excess charges. Other than that, let's go ahead and discuss what all Plan N covers, how much it covers, and why you may be interested in it. Okay, so let's look. And by the way, just to let you know, Plan N is becoming very popular. If Plan G is the new Plan F, then Plan N is the new Plan G. That may mean nothing to you, but in the insurance world, that's the saying that's going around. And there's going to be lots of people that will try to push Plan N. So, and that's fine. Plan N is a perfectly good plan, but make sure it's the perfectly good plan for you, right? So Plan N, let's look at what we have. We have 100% coverage on all items covered, with the exception of your foreign travel, and it's got an 80% coverage component there. So for you individuals that do travel outside the U.S., this may be one of these plans that you want to consider. Part A coinsurance, 100%. Part B coinsurance, 100%. First 3 pints of blood, your plan will take care of that, 100%. Your Part A hospice, your skilled nursing facility, and your Part A deductible. Remember, that Part A deductible, you can get hit with that more than once in a calendar year. So that's very good. Now, if you will note in your book, the one that they send to the house, the one that is so boring to read and no one really wants to look at it, but they really should anyway. This book right here, Medicare and You. If you look in your book, section 5, where it lays out all these on the table, you'll note that there's little three little stars next to these Part B coinsurance. I think it's very important that we read and see what these are. I had a great mentor one time. He said, when you think you found what you're looking for, you need to keep reading. Okay, that served me well, and it served me poorly every time I forgot that message. So let's look. Plan N pays 100% of the Part B coinsurance, except except for a copayment of up to $20, that means not to exceed $20, for some office visits, and up to $50 copayment for emergency room visits that don't result in inpatient admission. So that means if I go to the ER and I am admitted in a hospital for an overnight stay, then that $50 copayment may not be there. Okay, but otherwise you have $20 copayments for doctor's office visits, $50 copayments for emergency rooms. All right, now for you individuals that come from an employer where you're used to paying some form of copay when you go to see the doctor, this is really not all that different. Now in exchange for these copays, in contrast to, say, Plan F or Plan G. This is a very comprehensive plan. So they're going to give you a significant lower monthly premium on one of these Plan N's. Quite significant, especially if you're moving from like a Plan F to a Plan N. So that's why someone may be interested in this. They may say, well, if you look at the amount of times I really go to the doctor, which is only just a few times a year, and I'm saving almost 40, 50, 60, maybe more a month on this Plan N versus a Plan F, maybe that's something I should consider. And I'm just throwing out some numbers there as an example. You need to check for your specific case because it's going to be different depending on your age, tobacco use, etc., and service area. But yeah, people can really enjoy Plan N benefits. It can be very comprehensive for the right people. It can also help them save quite a bit of money. So when you think about all the other costs that you're going to have associated with your health care in your later years, saving on these monthly premiums is a big deal. So maybe Plan N is right for you. If it is, or if you think it might be, work with an independent agent. Contact us at CumberlandSeniorBenefits.com or reach out to a local office that's independent. Find out what the price would be for you from some of the most reputable carriers and see if this is something that you want to consider. With that, I believe that's all. Be sure to like, subscribe. Thanks for watching, and we'll see you next time.